For my 5-minute video on psychopathology, I am going to be discussing schizophrenia. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they've lost touch with reality, which causes significant distress for the individual, their families, and friends. If left untreated, symptoms of schizophrenia can be persistent and disabling. However, effective treatment is available. When delivered in a timely, coordinated, and sustained manner, treatment can help affected individuals to engage in school or work, achieve independence, and enjoy personal relationships. There are a few symptoms of schizophrenia, which include the psychotic symptoms, negative symptoms, and cognitive symptoms. Some of the psychotic symptoms include hallucinations, delusions, and thought disorder, which includes unusual thinking and disorganized speech. Negative symptoms include reduced motivation, diminished feelings of pleasure in everyday life, the flat effect, which is when that was 10% battery low. Schizophrenia. So the flat effect in schizophrenia is whenever a patient is unable to show emotion externally, not internally, because internally they may feel something different, but externally their voice is toneless, their face is flat, and that's why it's called the flat effect. And then just reduced speaking. Some cognitive symptoms include difficulty processing information to make their decisions, problems using information right after getting it, trouble focusing or paying attention just in general. There are a few risk factors for schizophrenia. It runs in genetics, there are environmental effects, and the brain structure and function of one's brain may also lead to the development of schizophrenia. Genetically, schizophrenia runs in families. However, just because someone in your family has it does not mean that other family members will. Many different genes increase the risk of schizophrenia, but no single gene causes the disorder itself. And it's not yet possible to use genetic information to predict who in your family will develop schizophrenia. An environmental factor that plays a role in the development of schizophrenia is a person's environment. So if someone's living in poverty, or they have stressful surroundings, and they can be exposed to viruses and other nutritional problems before birth, but that's early environment. The brain structure and function. Scientists think that there's differences in the brain structure and the function. Also there's different chemical messengers like dopamine that affect schizophrenia, and they can all help develop it. There are numerous treatments and therapies. Just to list a few, there's antipsychotic medications, and there's psychosocial treatments. Usually those two are used together. So like the schizophrenic patient will be taking their antipsychotics while also participating in psychosocial treatment. The antipsychotics can help reduce the intensity and the frequency of the psychotic symptoms. They're usually taken once a day in either pill or liquid forms, but there are other forms of antipsychotic medications which can be administered through injections once to twice a month. There are psychosocial treatments, which are like cognitive behavioral therapy, behavior skills training, supported employment, and these methods are useful. They benefit the patient. And then for the families of the patient, of the person affected, because it can be really stressful on the family and the significant other if they are married to that stage in their life. But they have multiple educational programs to raise the awareness of the family, of the significant others. It tells them the psychotic symptoms, treatment options, and the course of recovery for their development, like whether they're going to be able to get out of this or what their day-to-day life will be.